so much. Autism, we'll just talk about it a little bit. Oh yes, so the new ratio, which I'm sure a lot of you have heard, is 1 in 88 kids. So that's quite a bit of kids. And Debbie and I work with a lot of kids with autism. We also do like just basic expressive, receptive language, stuttering, etc. But we do a lot of work with children with autism, and I actually have a lot of teenagers with autism as well. So what to look for as a parent. So if you're seeing a lot of play, but it's not appropriate play. So let's say they pick up a car and they're not really going like vroom, 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 but they pick up a car and instead go, spin the wheels and just look at the wheels spinning. And of course, gross motor skills, fine motor skills. So fine motor is like picking things up or writing. So maybe they fall a lot or, things like that. Not responsive to verbal cues, acts as deaf. So you might call their name, oh, Roman, and they don't look at you whatsoever. And you might even enter a room and they may not even, recognize you or know that you're there. Little to no eye contact, and insistence on sameness. So they really, really, really are so obsessed with the routine. So let's say you pick them up from daycare and you always go straight home. But let's say one day you have to go to the dry cleaners, right? So you pick them up from daycare, you go to the dry cleaners, and then you go home. And that just causes a huge tantrum because that's out of the ordinary. It's not part of their routine. And that's lining up objects in a row. That's more play too. So once again, if it's the trains and they're supposed to play with it on the tracks, but instead they just take all their trains and kind of just line them up. And no pointing. So at first, right, the child has no words, and how could a child communicate with you? They communicate by pointing to what they want, right? But you don't even see the pointing, right? So they're not really able to tell you what they need, especially early on. And then sometimes there's no speech, or sometimes there's very little speech. And sometimes children with autism, communicate by using an assistive technology device. Has anyone ever seen those like iPads that have communication apps? And inappropriate laughing and giggling. So let's say something is not funny, they're laughing, right?
Sorry, at what point are these actual signs? Because it seems like a lot of things, like when they're young enough, they're all doing it,
Right, exactly.
And we actually tell parents that, you could look at this list and just pick your kid, Because one of the things on the list that they look, these psychologists are the ones who diagnose autism spectrum disorder. They'll walk into your home and they have this checklist, and they're like, does your child tantrum? Well, yeah, he doesn't tantrum.
Right, like
kids
that.
who put the car, you know what a car is.
Right,
It's like what age is it? Do you
So
start
basically,
paying attention?
early intervention tends to diagnose, I would say the average is between 21 and 24 months. Past the age of 3, they tend not to diagnose. It can happen, but I've had parents that had to fight for a diagnosis. It's usually diagnosed prior to the age of 3. But I think most of my kids, it's like...
And it has to be like many of these things.
Yes.
Of course, all children do these things from time to time. And so another big thing is the echolele, which is repeating, what they just heard. So if you say, what's your name? They say, what's your name? Instead of saying their name, right? And it could also be delayed echolele. So maybe they were watching Sesame Street in the morning, and in the afternoon they start singing the song that they heard, in Sesame Street, which, yes, once again, you might see a child doing, but it's just the way that it's done that, like a professional kind of knows when they walk in. Spinning objects, so clapping hands for stimulation, so they need a lot of sensory input. So they might be rocking back and forth, clapping their hands, or even going like this, for extra input. I'm trying to think other ones that we didn't really talk about. And then, some of them do talk, right? They can hold, they could say hi to you and, hold a basic conversation, but, they have difficulty maybe maintaining that conversation or looking you in the eye when they speak to you, or just forming, friendships. They have difficulty initiating conversation with someone in class, so it's really our job to teach them basically how to socialize. Okay, if you enter a store and you want to buy something but you don't know where the grapes are, how could you ask somebody? You go up to someone that works there, you say, where are the grapes? So just going through things like that.